Okay, good evening again. Welcome everyone to this evening's workshop webinar with our facilitator, Dr. Sharrica Miller. I am Dr. Dania Dunkley, and I'm the founder of the League of Extraordinary Black Nurses. I'd like to thank Dr. Miller for joining us and agreeing to host this workshop. So tonight our topic is Beyond the Bedside, Level Up. All right, so we're gonna talk to you guys about whether you're a beginner or you're getting ready to enter the field, or you're somewhere mid-career or looking to progress upward into the nursing profession. We've got some tips here. Dr. Miller's going to share some tips on how you can level up and present yourself as a good candidate and basically work towards achieving your goals in the career. I'm just going to begin and go ahead and officially introduce her. If I can get my situation pulled up here, read her bio. Okay, so Dr. Sharrica Miller is doctorally prepared, board-certified pediatric nurse practitioner with over 14 years of experience in nursing and nursing education. She is the founder and CEO of Starter Nurse Academy, an online professional development resource for new graduate nurses. After spending 12 years of her childhood in foster care, Dr. Miller went on to obtain her BSN from Howard University and worked bedside in multiple areas, including pediatrics, med-surg, and critical care for 5 years before going back to school to obtain her master's degree. She recently earned her PhD from UCLA in 2017 and was named as one of 5 Johnson & Johnson's Minority Nurse Faculty Scholars 2 years in a row. She has been teaching pre-licensure nursing students and new grads for 8 years, and during that time also worked in a variety of settings, including home health, hospital-based education, public health, and palliative care. Dr. Miller is a foster youth mentor, advocate, and researcher who recently won the 2019 Diversity, Inclusion, and Equity Award at California State University, Fullerton. Congratulations for her work with foster youth, both on campus and in the community. Her advocacy work was also featured in a national televised LinkedIn commercial as part of their 2018 Heroes campaign. She's committed to improving the health and well-being of transitional age foster youth through research and legislative action. So without further ado, Dr. Miller, take it away.
All right, thank you. I'm still at the point where I'm getting used to like the part, you know what I mean? It's like, what do you do when somebody's introducing you? Do you just right. You just say like,
smile,
right? Right. So I'm still working on that, but thank you for that very, very warm introduction. I'm so excited. I see so many familiar, I guess I won't say faces, but names. Definitely a lot of you guys that I know. So I would love for, as we're getting started, if you put in the comments kind of how did you come about this webinar? Are you LEBN members? I know we have some Black on the Job people here. Put that in the comment. Did you come from Starter Nurse Academy? Did you come for Dr. Dunkley's page? Did you come from my page? So go ahead and put in the comments to just introduce yourself. Let us know if you're an experienced nurse and kind of what you are hoping to get out of this presentation. And so hopefully you're not new to Zoom, but we do have a chat function there. And I encourage you guys to please put comments throughout, questions throughout. I watch the chat the whole time that I'm presenting. So if you have a comment or you have something to say, definitely put that on there. Somebody just commented, Patricia, all right. Well, thank you, Patricia, for recommending this person to come. And BLTJ, that is Black on the Job. For those that don't know, it's another professional development organization that actually my sister owns. And so I consult, I'm her curriculum consultant for that organization. And so I posted that in our group and I know a couple of them. So if you see the BLTJ, that's them. Stephanie is one of my OG starter nurses. I coached her I think I like just started. Somebody found it through Starter Nurse, through LinkedIn. I think we both posted it on LinkedIn. So welcome everybody. Please use that chat function. We want it to be engaging and interactive. And today we're talking about level up, how to level up in your career. So I'm so happy to see so many people from new grads, to experienced nurses. And Kim, I remember you. We had a chat the other day. I definitely remember you. And for those of you that are new, if you want, you can turn it to just speaker view, and that should show just my face. I'm not sure because I kind of just see yours, Dr. Dunkley. I'm not sure, but you can put it on speaker view, and
Are
you
you still seeing me? I shut my video off.
I just see your, like, when I put speaker
Picture.
view, it puts you there in the front, but we'll see what happens when I share my screen. So let's go ahead, jump on and get started here. All right. Yeah, see, I see you next to me. I don't know if they see me. Can you guys put in the chat as I'm talking and sharing my screen, see my picture or Dr. Dunkley's picture? Let us know. We still working out some stuff over here. Let us know. Either way, as long as you can hear me, that's okay. We see both of you. All right, that's perfect. Okay, so level up, how to advance in your career. And most of the time I keep the camera on because I'm kind of a little bit animated. So I need y'all to see this hand flapping that I got going on and see how exciting. Hello, Lucretia from BOTJ, data nurse with MSN in nursing informatics. Oh, great. We're going to be talking about your field. So that's awesome. So welcome. We're going to actually center this presentation and focus really on three main areas, meaning three main kind of ways that, and I career coach, I'm going to go through my history a little bit more, but three ways that when most clients come to me to level up in their career, three sort of areas that they're typically looking to go, right? Either down an academic path because they want to maybe expand their opportunities and have more options. Some are just looking for side hustles, a better way to make money other than having to work multiple shifts. And some are actually looking to branch out and become an entrepreneur, which I love. I love that as nurses, we are now becoming entrepreneurs. As you know, Dr. Dunkley is the founder of LEBN, League of Extraordinary Black Nurses. So thank you to her once again for inviting me, and just me having a network of other nurse entrepreneurs has been huge for me in terms of running my business. So we're going to definitely talk about that. So for all three of those areas, I'm going to give you lots of options, lots of tips for how to position yourself in a way so that those opportunities become available to you, right? So if we're talking about academic, how do you get into these really competitive master's programs? If we're talking about side hustles, where are they? What are side hustles that you can do? And if you have this itch to start a business, where do you even begin, right? Because I definitely remember being in that position. So my journey into nursing, and I know she gave you guys all of those specifics, but in terms of my journey as a nursing, I actually began as a certified nursing assistant. So y'all see me there with the swoop and the lip liner. Okay, the glow up has been real, but this was back in high school. I went to high school in Compton, California. And as Dr. Dunkley mentioned, I was coming out of foster care. I was kind of trying to find my way, stumbled onto this CNA program. They had kind of a vocational programs at my high school, like automotive, cosmetology. So I was like, I guess I'll just do nursing. And from there, I got my first CNA job at 16, and kind of really knew, that I was going to go into nursing. And from doing that, I've worked in a bunch of different settings. Obviously, I went back and got my master's to become a board certified peds nurse practitioner, then went back to UCLA and got my PhD. But all through that, I've worked. I've always worked pretty much full time. I think in my BSN program, I worked 20 hours a week. I had work study. But other than that, I've always worked full time through the master's and through the PhD, always had multiple side hustles, right? I was like the side hustle queen. I call myself the side hustle queen because I got a whole bunch of ways I can make money in this nursing profession. We have so many options, y'all, that you definitely don't want to limit yourself. And I've worked in a lot of inpatient settings like peds and PICU, but I've also worked home health. I've worked infusion centers. I've done hospital-based education as an independent contractor, clinical instructors on the side, teaching an online class, doing adult critical care. So I've had a bunch of different side hustles. I have started my own business, and I have went up the academic ranks. And that's why I'm focusing on those three areas in order to lend my insight and expertise to you to figure out if one of these three areas are for you, how do you get started, right? So let's start with academics. And before we get to the academics, I want to tell you guys kind of what I'm doing now. So I've been a nurse now 15 years. So kind of where I am now is I'm a faculty member. I teach at a BSN program and a DNP program out here in Southern California. I'm obviously also the founder of Starter Nurse Academy. I am a nurse career coach. So these are both sort of, I think I look at Starter Nurse Academy more as my business, nurse career coach a little bit more as like my side hustle, because I don't have like a formal website and stuff yet. I'm also a curriculum consultant. So what that means is that companies come to me and pay me to design curriculum for their educational programs. And that's what I was just talking about earlier, Black on the Job. I know we have a couple of B's, we call ourselves B's in there. And that's a company my sister started actually 2 years ago. This is my baby sister, and she wanted to create e-courses. And so she didn't know anything about creating the e-courses. And so she brought me as a consultant on. And because I had experience teaching, experience designing curriculum, it was an easy fit, easy transition. And I've made some good money with my sister, y'all. BOTJ has paid me well. So I designed a negotiation course, a leadership course for them, an interviewing course for them. And that practice is kind of what gave me the skills to do the courses, the e-courses for Starter Nurse Academy, which are kind of similar, interviewing courses, etc. And then I also have multiple other side hustles where I facilitate workshops, such as this one is definitely one of my specialty, and get booked for speaking engagements. Most of my speaking engagements, my paid ones, are usually foster care related. So I've done workshops for foster youth organizations or motivational talks for different events that foster youth organizations were having. And so in doing that, that has been a really good side hustle as well that pays me. So now we're going to get into academics. Hello, Kenya. I see your comment. Nurse tech from 95 to 2009. And look, you've had a whole bunch of side hustles too. And I see your comments. So please keep sharing. So let's jump right in. 3 different areas. Okay. Maybe only one of these areas apply to you. But we're going to start with academics. And some of you guys may be BSN students that are, or BSN graduates or working, and you have your BSN and are thinking like, should I go back to grad school? And I have a lot of clients that will come to me and they don't really have a purpose yet for why they want to go back to grad school. And maybe they just want to go back because everybody else is going back, or they think that's the next step. Or a lot of times what I see is people go back and then figure out what they're going to do later, right? And you don't want to do that. Whenever I have my coaching sessions, we start with the goal first and then work our way backwards, right? We're not going to just jump into an MSN program or a DNP program and then like graduate and like, okay, now what do I do, right? So before you even go back or consider going back, this is what you want to consider. Number 1 is how saturated is your field? So a lot of BSNs, nurses that work as BSN at the bedsides want to go back for nurse practitioner. The first thing you need to be asking yourself is, how saturated is your field in the geographic area that you want to work in? Usually by now you are an experienced nurse, you have work, you probably settled down roots, have a house, kids. But if you're young and you can move around or you have that kind of lifestyle, that's great. But you want to think about how saturated is that specific specialty, right? For example, if you're thinking about going to school to become an FNP and you live out here in the Los Angeles area, you need to search for FNP jobs right now before you start, before you put the application in, before you even do anything else. You want to start to search for those jobs right now and see, are there any F&P jobs available in Los Angeles? How much do they usually pay? What kind of experience or qualifications or certifications do they want me to have in addition to the MSN or the DMP, right? So don't jump in the field. And I wouldn't say don't jump into it, but rather know what you're getting into, right? It could be a tough market, but still know what you're getting into. Second thing you want to think about is, what is your return on your investment? There are a lot of for-profit masters and DMP programs, and are they giving you a return on your investment? Now, it's an easy decision to go to nursing school because the jump in salary from non-nurse to nurse is huge, right? But sometimes the jump in salary from nurse to nurse practitioner may or may not be that much, depending on what type of nurse practitioner you're going for, depending on where you live, depending on the geographic market, the area, right? So you want to think about, what is your return on that investment, right? Because going back to graduate school is an investment like any other investment. You don't want to just dive in and pay an arm and a leg and not get anything back. However, this is what I also want you to think about. Investment and your return on your investment is not always financial, right? So I started going back to school, going back for my master's and then again my PhD, not necessarily for a financial return. I'm not getting rich because I have my PhD. I know AD nurses that work, my brother's one of them, well, he has his BSN now, that can work 4, 5, 6 shifts and easily make what I make or more, easily, okay? So I went back to school. The return on the investment for me was freedom, right? And Dr. Dunkley can probably put in the chat and attest to that as well, which is that PhD gave me freedom, gave me opportunity, gave me options, and also took me away from the bedside where personally, I didn't want to be personally. The 12-hour shifts, I couldn't do it, right? Quick story, I was doing the workshop for my new grads the other day, and I was telling them that when I went back to the PhD program, I was like, all right, let me go back to the bedside to get one more round of some bedside experience so that when I graduate and I go teach, I have fresh bedside experience, okay? Now, I haven't been to the bedside in a couple of years. I'm on orientation and they walking me around and I'm like, oh, what's that little black box on the wall? That's cute. They was like, oh, that's the Chronos clock. I was like, oh, what's the Chronos? That sounds cute. What's the Chronos? They were like, oh, you don't know what a Chronos clock is, right? And so I'm like, no, I never heard of that. What's that? Because I had been away from the bedside for a while, right? I had been teaching. I had been working with my masters. I had freedom. I had autonomy. So they telling me the Chronos clock, they're like, oh, you got to take your badge, see? And when you come in the morning, but you can't do it before 6:57, you got to clock in. And I was like, oh, see, this is it for me. I cannot be in the position where I'm clocking in. So return on investment for me was autonomy and freedom. Return on investment for me was to be paid for my thoughts and my knowledge and be able to do a workshop in a blazer and some pajama pants, right? That was the return on the investment for me, to not have to wake up early in the morning and do those 12-hour shifts. So as you think about that investment, make sure that you're thinking about that. And number 3, what I want you to think about is the reputation of the school in your industry. So make sure that that master's program that you apply for is reputable, is not blackballed in your industry. And we're not going to go into specific schools right now, but you can Google the reputation of the school. You can talk to other people that went there. And I would also talk to employers in the field that you want. So for example, if you want to go into academia and you're going and getting your DMP from a certain program that may have a reputation that is not favorable in our field, you want to talk to different people that work in academia. You want to ask them, how do they feel about those degrees? And when they get those degrees, are they accepting them? All right, let's talk about some in-demand programs. In-demand programs right now. Definitely informatics. And so somebody was just chatting. Let me see, let me go back a little bit. Somebody here, is it Lucretia, currently a data nurse with an MSN in nursing informatics, trying to figure out where you want to go from here. Yes, Lucretia. So getting a degree in informatics is a great way to bridge the gap between technology and patient care. And I am a big fan. So I'm going to already tell you guys my bias. I'm a big fan of, if you have a bachelor's and you're going back for a master's, and you can find a master's DNP combination program, right? So I just have a client right now. We're working together to get him into this DNP and informatics program at University of South Alabama. So he would do the first 2 years, have his MSN in informatics. He could start working right then. And then the last 2 years do his DNP. Now, what does that DNP do for him? That DNP puts him in a position where he could go to large teaching hospital, university system, healthcare system places like UCLA. I'm out here in Southern California. We have a ton of magnet status hospitals. So if he has his DNP in nursing informatics, he could be the chief healthcare informatics person at the hospital, right? Basically, he could be the one that runs the whole department of informatics at the entire hospital or within the hospital system. So I love informatics. You don't have to have a degree in informatics. Some people kind of stumble into that role, but I can tell you that if you are planning to go to certain hospitals, they're gonna want you to at least have the master's. And if you're planning on going to a big name hospital, a Stanford, an NYU, a UCLA, et cetera, Emory, they're probably gonna want you to have the doctorate. Other in-demand programs, DNP and executive leadership. Some of you guys want to advance your career by going up the ladder, maybe as a nurse manager, right? Or director of education at a hospital, or in some other leadership capacity, chief nursing officer. Dr. Dunkley, tell them about it, okay? She is a chief nursing officer, has been in that role before, right? And so having your doctorate definitely, absolutely can help with that. And yes, I love the PhD. The PhD can put you in that leadership role as well. But honestly, those DNP programs are really, really good for leadership positions within the hospital, especially. Whereas the PhD is going to give you a really solid research base and really give you the analytical skills that you can need to work in academia, to work in leadership, to start your own business, to blah, blah, blah. But that DNP and executive leadership is like, we're going to teach you how to be a leader. And I didn't get that training in my PhD program. Obviously, you could do the PhD in nursing. And the reason why I say these are in demand is because less than 1% of nurses have a doctorate degree. Now, this workshop is being put on by League of Extraordinary Black Nurses, right? So we obviously have a philosophy and an idea of how we're thinking in terms of how we can level up as Black nurses. The majority of us in the room are probably Black nurses. So thinking about less than 1% of nurses have a doctorate degree, believe me, once you have a doctorate degree, the opportunities will just come to you. They will be plentiful, right? And the other reason why I say the PhD in nursing is the return on your investment, because for the most part, I'm going to say about 80, 90% of the time, when you're going for a PhD in nursing, you're not going to pay. And not only are you not going to pay, you probably will have a fellowship that will give you a stipend, that will pay your tuition and give you a stipend to try to get you not to work. I took the stipend and I worked. So when I finished the PhD program, when I finished the PhD program, I was like, dang, my income took a little bit of a hit because I was used to getting that $21,000 and that fellowship money every year. I wasn't in a rush to finish that. I got to around the year 4 and I was like, wait a minute, I could just chill and keep getting this $21K, right? CRNA, ooh, definitely in demand. Very difficult program to get into. We're going to talk about how to position yourself for these grad programs. We all know that's where the money is. But you need a strong ICU background, and they are competitive programs. And then in terms of nurse practitioner programs, I specifically pulled out Gero and Psych. We're going to have a huge mental health boom. We are having a huge mental health boom. And so Psych NPs are absolutely in demand if this is your area, if this is what you like to do. Additionally, with that psych NP, and we're going to talk about a side hustle in terms of you could work in pain management and addiction and make some really good money like that as a psych NP. And then, of course, we know our baby boomers are getting a little older. And so, of course, that Gero NP is a good degree as well. All right, so if you're considering taking this path, here are 5 areas to focus on. And let's look back at the chat. Oh, that's right, Dr. Dunkley, you've done research on chief nursing officers. Lakeisha says, I currently work for an informatics company. I enjoy what I do, but I like to transition to the documentation integrity coding side and become a consultant. Yes. And so that is exactly, Lucretia, what I've talked to my client about was that him getting that DMP. So he already has experience as a super user and as working in informatics at his hospital, but he's at like a really small community hospital. So he's able to do it with his bachelor's. Once he gets that doctorate and he gets experience as like director of informatics, oh, he can consult. I know informatic consultants that basically left the hospital and then went back to the hospital as a consultant. Like, now pay me to do that same exact thing, only now I'm going to do it on my own schedule and I'm going to charge you way more for it. Patricia, BSN prepared nurse, bedside nurse for 12 years, trying to figure out the next step. All right, that's why you're here. Okay, so quickly, if you're thinking about going the academic route, and then remember, we're going to talk about side hustle and entrepreneur routes next. So if that is your focus, stick around, we're getting to that. But if you're considering taking this path, here's kind of what you want to think about. This is what master's programs and doctoral programs in general are looking for. And I came up with this acronym the other day, actually, when working with my new grads and trying to teach them an acronym in an easy way to remember the 5 areas of their career that they want to focus on to position themselves for new grad residency programs, going back to school, etc. So let's look at the GLUVI. Yes, Stephanie, you remember the GLUVI, except I changed the examples now for experienced nurses, but it's mostly the same. First thing schools are looking for, and let me preface all of this by saying you got to have a good, solid admission essay. You need a really good resume or CV, right? So these are the things that, these 5 things that I'm going through are the things you need to do, but you got to be able to articulate it in that cover letter as well. So you could do all of these things and blow it on the cover letter, okay? So in your cover letter, you need to be able to articulate that you have a clear plan for your future and that in some ways your plan is bigger than the bedside. Now, what do I mean by that? I mean that even if you're planning on being a psych NP and working clinically as a psych NP, but you need to have kind of a focus or a niche or a vulnerable population or a social justice issue or kind of a bigger thing that you're trying to solve, right? Because when you articulate why do you want to become a psych NP, they're going to want to know, you know, I'm really, really interested in LGBT mental health and suicide. And I want to go back to become a psych NP so that I can really impact that population. So you need to be able to articulate in your admission essay a clear plan for your future, and also it needs to expand beyond the bedside, right? Because y'all, don't get me on my rant. Nurses are leaders. We are advocates. We are policymakers. We are change agents. We are leaders. We are more than just at that bedside. And if you're applying to competitive graduate programs, I just had a client I worked with who got into the DNP program at University of South Alabama, University of Cincinnati, University of Missouri. The last 2 were pretty competitive. So we had to really articulate his vision beyond the bedside, right? Your leadership experience. So if you're working right now as a bedside RN, you should absolutely be getting involved in shared governance committees. That is how you get your leadership experience in, and that's a really time efficient way to do it because you can do it right at your hospital, right at the bedside, right? But what if yes, Kenya, nurses are everything, yes. What if your hospital doesn't have shared governance committees? That's even better, because guess who's going to start the very first Shared governance committee. You are. And when you're in your next interview for the next position you're trying to level up, when you're applying for this, or you're writing a cover letter or writing an admission essay, tell us about a time you demonstrated initiative. Oh, I know, I was working at a small community hospital and I started a shared governance committee to reduce falls on my unit. And in doing that, this is what we did. And we researched best practices and we implemented a new policy that resulted in a 30% reduction in falls. That's how you level up, right? Whether you're interviewing for another job, leveling up, or applying to a doctorate program or a master's program, that's how you're going to level up. Someone else sent me a message privately that said our online DNP programs look down on. It's not the format of the program, it's the school. So I think, for example, University of North Carolina has an online hybrid DNP program. So it's not the format, it's the actual school. Great question. Education. So when you're applying for these graduate programs, and one other thing you can do is get CEUs in your specialty area, or just CEUs. Like a lot of my new grads have gotten the COVID-19, that free CEU that they gave to everybody on management of the COVID-19 patients. I always tell them to do the NIH stroke certification. A lot of them do the child abuse and safety one. So in your specialty area, so if you're going for CRNA, right? Well, first of all, you absolutely need to get your CCRN certification, but any other emergency management CEUs, conferences, webinars, workshops, events, groups, right? Because we're going to talk about networking in a second. So you want to immerse yourself in that career and show whether you're applying for a job to level up or applying for a graduate degree to level up, but you want to show that you are passionate about this particular field and align all of your activities that way, right? Plus, of course, they're going to look at your bachelor's. Your work experience. It's great when you have work experience in the specialty area that you are actually pursuing, right? Meaning, if you are a super user at your hospital, like you help them roll out the Epic, you're always the super user, you're the champion, you're the Epic champion, and now you're applying for the DNP nurse informatics. That looks great. So when we write your admission, and I say when we, right? Because a lot of people hire me to write their admission essay for them or rather revise it for them. We're going to angle it and demonstrate how we have this passion for technology and how we want to use technology to help improve patient outcomes and give examples from things we have done in the past, right? We're also looking at charge nurse experience. That's another way to even have leadership experience, right? So those are ways to demonstrate that. So let's look at some comments. What should someone look for when deciding on a DNP online program? You should absolutely look at the reputation. And the best way to find a reputation is honestly just Googling. You can even Google, like, what is the reputation of Chamberlain or whatever school your online program you're thinking of, right? What is the best, most efficient way to narrow down your niche? You have a bunch of interests. That's okay. It's okay to have a bunch of interests, but you do at some point have to figure out kind of which way you're going to go. And here's the reality of it, Marie. And this is the come to Jesus moment we have during the coaching sessions, right? Which is that you have to know yourself in order. I think what I posted was a lot of us are struggling with figuring out our next career move because we are still trying to figure out ourselves. Can I get an amen? Sometimes we are struggling to figure out our next career move. Like, do I really want to go back to school? Do I really want to start a business? Do I really want to side hustle? Do I really want to go to P's? We are still struggling to figure, because we're still learning and figuring out ourselves. So the first thing we have to do is take a step back and figure out what are the things that are important to us. So I've been there. I've been at the point where I'm like, what do I want to, I don't know, what do I want to, right? So then I had to think of my core values. My core values are, one is autonomy. I do not like clocking in and being told what to do and where. So that's why education works for me. Two is I wanted flexibility in my schedule so I could see my daughter. So working in academia, I'm on campus maybe 15, 20 hours a week. The rest of the time is spent here, okay? And three was I wanted to have an impact. And that's kind of where the Starter Nurse Academy came from. So me knowing myself and getting really clear with what are my main values and what is most important, right? So it's like dating. You guys know I always use that example. It's just like dating, right? You might have a whole lot of types. We all got, right? We all got a lot of types. But what are the main values that are important to you when you're picking out a partner? That's what you have to narrow down, right? All right, what should you consider when picking a topic for your DNP? I would say consider what you already have experience in, what you're passionate about, and what you have access to. And Ashai, I don't want to plug here, but I facilitated a 2-hour DNP PhD masterclass where I went over the different types, the 2 different types of program. I went over how to do your mission essay, how to reach out to different faculty, how to narrow down your research topic. And that's actually an e-course now. So it's an e-course that you can take self-paced. So if you're trying to figure that out, that is a good place to look. All right, let's keep it going. I don't want to keep y'all here all day. We still got to get to side hustles and entrepreneur, y'all. Looking at your volunteer experience. All right. Somebody just sent me a private message. What suggestions do you have for me? We'll come back to that private message. If it's a very specific question that specifically relates to just your specific situation, you might need to set up a coaching session, okay? But I will try to give you general tidbits as much as possible, but I can't tell you like if going back to school is right for you until I hear about your background, your interests, your priority, what are your goals, what's your family situation, your financial situation, your academic background, etc. Okay, so I don't like to just give like drive-by advice, but I can give you quick tips. All right, so you got to get some volunteer experience in. They like to see that, you know, as much as possible. You want to align those with your goals. So I have always been passionate about being a foster youth advocate. I've done the overwhelming majority of my community service and foster youth advocacy capacities. And that has been my narrative. That is my hook. You know, when they say, tell us about a time you advocated for, that's where I go, okay? All right, last tips for academic level up before we jump into side hustles. For those that are interested in that, all right, you need to have a stellar resume. As somebody that reviews resumes often and has done so in the past, either from hiring new grads, admitting accelerated students into our highly competitive program, admitting DNP students into our program, and working for Black on the Job and revising resumes professionally for them, and now revising resumes professionally for Starter Nurse Academy, I can tell you that your resume will make or break whatever type of leveling up you are trying to do. You're trying to branch out and get this other job, you're trying to move up in your company, you're trying to go back to school, your resume needs to be sharp, because I'm gonna look at it, I'm gonna glance, I'm gonna chew, and I'm gonna push it to the side. And I'm telling you this as someone like, I'm on a panel of interviewers and we're all having that same consensus where we push those resumes to the side. So invest in yourself. There is so much free game on how to do a stellar resume. You just got to put the legwork in, or you're not lazy like me. I'm kind of person that's like, here go the money, do the resume, give it back, right? That's why I love our profession. All right, you need a very well-written cover letter or admission essay. I can't tell you again how much that'll make or break. Make sure you complete applications in their entirety. And I want to talk mostly about those last two. I want to know in the comments who has a LinkedIn and how active are you? No matter what, whether you go an academic route, side hustle route, or entrepreneur route, you need to have a robust, active LinkedIn. So who's on LinkedIn? I know Stephanie for sure. Stephanie's just a nursing student at Southern University. And she has a pretty good, stellar LinkedIn. Dr. Dunkley and I are on LinkedIn. We're on there. Jennifer, 2 to 4 times a month. All right. I have one, but not active. Okay, and I say that for a couple different reasons. Number one, when you first apply to a graduate program, we probably are going to Google you and look at your LinkedIn. Number two, if there's a side hustle, I know we're getting ready to transition into side hustles and entrepreneur roles, you're going to find your people, right? So, for example, if you're thinking about going back for informatics, you should be adding, I think it was Lucretia, right? You should be adding Lucretia. You should be trying to figure out, Lucretia, what is your LinkedIn? What is your social media that you have open, to the public? And you should be adding her and seeing what she's doing. You should be, if you're thinking about going to CRNA school, you should be immersed and have a timeline full of CRNAs, CRNA students, CRNA faculty, everybody that's in that field. Okay. And the last part right here is you want to have a positive digital footprint. Now, 10 years ago, Kenya said, I'm on LinkedIn, but I use it to learn what's going on. Yes, Kenya, good. Another plug, all right. I have a LinkedIn e-guide. It's called Everything Nurses Need to Know About LinkedIn to Advance Their Career. And right now it's on sale. It's not even like $15 or something like that. So if you need help with your LinkedIn, it's a really quick, easy to use e-guide that basically shows you these are the 5 areas of your LinkedIn that you need to focus on. This is who to add, and this is what to post. All right, so it's just to kind of get you going. But 10 years ago, we kind of had this philosophy of like, stay off of social media. Stay off of social media. Don't go on social media. And now it is different. You want to have a positive digital footprint. I'm okay with if I'm going for a speaking gig and they Google me, I want them to find Doc Miller Nurse Coach. I want them to find my LinkedIn. I want them to find my Facebook. I don't want them to find my personal Instagram that I keep very, very, very hidden away and do not add anybody that I do not personally know. Okay. So I can act the fool on that one. All right. But I want them to find my professional social medias so they can see what I'm doing. And a lot of times that's going to help them make a judgment and determination about you. So I want you to work on having a positive digital footprint. You want things to pop up when people Google you. Okay. All right, guys, we're getting to side hustles. And I love you all, but I'm going to take off my jacket. I ain't put a blazer on and since BC, before Corona, okay? So, usually for my new grads, I get a t-shirt. I was trying to get a little more professional for y'all, League of Extraordinary Black Nurses, but I'm going to have to take the blazer off, okay? All right, so side hustles. I was a side hustle queen, y'all. I have badges. I have so many badges in my car, y'all, from being a grad student, from being a nursing instructor. The premier nursing services was me working a per diem, adult per diem experience. I think this one was nurse practitioner school. This UCLA one was a side hustle. So I had a whole bunch of side hustles. And we're going to talk about different side hustles. I'm going to go through and give you 10 quick side hustles. How we doing? 3, 4. All right, we good. But first, let's start with the 5 side hustle commandments. You want to start with what you know, and you want to start with who you know. So as you're branching off on your side hustles, what are your thoughts on LLC? You might have to be more specific there. Is it a Shidi? I think I'm saying your name right. If you're meaning having an LLC for your business, you definitely need one. So expand there and let me know what you mean. So for your side hustles, it's good to start with what and who you know. Meaning, like, I worked in peds and did a lot of IVs and IV antibiotics. So one of the first few side hustles I had was pediatric home health and hospice, because I already knew peds, right? And I'd already worked PICU where they were dying all the time. I worked PICU at UCLA. They were just dying left and right? So I got used to that. And then doing infusions, because I had started so many IVs and did so many piggybacks, right? So I started kind of in the beginning as I was branching off. These were like my first side hustles. And I'm like, I don't know. I've only been, working as a nurse. I never done anything else. So I started with that. I was also, as I worked at the bedside as a new grad, I became a certified diabetic educator. So I'm like, I can educate. I like to teach. All right, I'm going to try to go teach at an LVN program. And that was one of my other first side hustles, teaching clinicals at an LVN program, right? So starting with what and who. This is why social media networking is so important. Dr. Dunkley and I would have never known each other without social media. I have gotten a ton of opportunities from social media. And just as a sidebar, because we're going to transition into entrepreneurship if you're thinking about starting your own business, I have yet, don't kill me, Dr. Dunkley, don't cringe over there. I have yet to even have a website yet for Starter Nurse Academy. I have the little link tree, and I have, when you click on it, it takes you to Teachable, where all my courses are housed on that platform, but I still don't have a website because as of now, I have done everything through social media. All of my marketing, all of my clients come from either social media or word of mouth. So it's who you know as well, right? Not just what you know. Third side hustle commandment. You don't want to do a side hustle within your same hospital, okay? And you possibly want to consider going into a different setting. And by that, I mean, if you're working acute care, 3-hour shifts in the ICU, don't go and get another ICU position at a hospital per diem. Right? So that is my general rule of thumb, is that your side hustle should not involve extra shifts. This is my personal insight. I don't believe in working 4 and 5 and 6 shifts to make more money. I just don't. I think that that's an easy way to burn out. Just my personal opinion. Now, I've told my brother this for years. He does not listen. This boy will work, or rather man, it's my big brother. He will work 4, 5, and 6 shifts every week. All right. This dude got 4 kids. His wife is in nurse practitioner school and he's in a DNP program. I'm like, bruh, you gonna go crazy, okay? But he's so much more like this than I am. He's a doer and I'm more like a thinker. He want to get paid to do. I want to get paid to think and present. Okay. So I don't believe in extra shifts. Okay. And last one, you want to kind of try to do something you actually enjoy. And look, you got to start to develop this level of entitlement. And I've talked about this before, how important it is to have a level of entitlement. You know what my entitlement is? I deserve to be happy where I work. I deserve to be doing things that I love. I deserve to feel fulfilled at my job. I deserve to be paid what I'm worth. I deserve to be at a company that values and respects me as an individual. And you have to have that same level of entitlement about your career. And I've said before, I was super bougie with my career. I'm not even gonna front you. I'm gonna be very transparent. I was bougie. I was only working at Magna Status hospitals. I negotiated. You know, I wanted to be at the best facility where I had the best resources, and I know. So at the hospitals that I worked at, I have colleagues there. They weren't short PPEs when coronavirus hit. I was like, ooh, they got y'all in there using the same mask? Oh my God, I would never work for a hospital like that. Are you kidding me, right? So if you're not a new grad and you have 1 or 2 or 3 years under your belt, you have options. You have options. And why not be getting paid for something you at least somewhat enjoy, you halfway enjoy, right? And not waking up miserable. And I can tell you guys right now, I have had a miserable position. When I was in the PhD program, I worked for a school that I didn't particularly like. I wasn't happy, but I had a goal, y'all. I was getting there. Okay, so I had this little. I don't know if y'all can see it, but I had this right here in my office that was like, "Come on, you about to be Dr. Miller in 3 years. Stay focused." Okay. So I worked that miserable job for a little while because they paid me real good and they were working with my schedule while I was in the PhD program. But I am happy right now where I am. Okay, I'm happy teaching, coaching, and running my business. So you want to get to that point too. All right, side hustles for the burned out nurse. Put a 1 if you ready. Put a 1 if you ready to hear these 10 side hustles. AKA, give me a chance to drink my water. All right, and these are just some ideas. All right, y'all ready? I'm making sure. Do what you got to do so you can do what you want to do. Yes, Jennifer, I don't know if you got that from me, but it sounds like something I would say, okay? I know what else I say. You got to put in the work now so that you have career options later. Stephanie, you are a nursing student. You are here on time, baby girl. So put in the work right now so that, because those 15 years are going to fly by. I feel like I was just at Howard graduating in 2005. Okay. Those 15 years, and you want to get to a point to where the opportunities start coming to you because of all the work that you're putting in, right? All right, let's get to the side hustles. These are just some ideas. I'm just throwing them out there. Some of them are kind of can be entrepreneur activities. So we're going to kind of transition in. Here we go. First one, educational based services. Very easy to start. Okay. This can be NCLEX prep. This could be CPR. This could be doing online virtual workshops, right? I have workshops coming up when on the 30th. I'm doing an interviewing workshop for new grads and a resume and cover letter workshop for new grads. Last month, I did a workshop for doctoral students, right? Very good money. Good. I mean, you know, y'all here, we've been transparent, right? So for the DMP workshop, I charged $100 because it was a 2-hour workshop where I was basically giving you in a very structured way how to do that cover letter, how to do that admission essay, how to pick your research topic, which program, how to get funding, all of that, right? So $100, and I had 20 participants. The whole thing filled up. The whole thing was sold out, right? That's good money. That's good money to just post and advertise and engage. But people didn't just run up to me and start throwing money at me, right? I definitely have worked my way up to that point. So starting at a smaller level can be on a side hustle basis, can be, for example, Kaplan. If you have your BSN and a couple years experience, Kaplan is always looking for NCLEX instructors. And the benefit of going that route through a company like, let's say, Kaplan, is that they're going to teach you the right way to teach, you know, the decision tree and all. Y'all, that's one thing I stay away from. I stay away from NCLEX stuff, NCLEX tutoring. I send them, I got a whole bunch of people to send them to. I don't do that. But they teach you the decision tree and, you know, test taking strategies. Then, let's say after you've been working for Kaplan for a year or two, now you can branch off and start your own NCLEX prep, right? So, is it New Nurse? Yes, New Nurse University. New Nurse University. Renee, I think Dyson is her last name. Young Black girl, or young Black lady, I should say, and has her own business doing tutoring and NCLEX prep. She actually helped my sister pass her HESI. She has a great program. So if you're thinking about going that route, you want to start to network and surround yourself with those people. There are some cons in terms of if you do this as a business, it's going to require some investment, usually time. And if you're doing CPR, possibly money too, because you have to get the mannequins and stuff too. All right, cannabis industry. Cannabis industry is huge right now, right? There are people that work as cannabis coaches, people that help clients basically that are using medicinal cannabis or CBD oils and tinctures and all of that for different pains or stress or whatever. And there are nurses, cannabis nurses, right? And then there are nurses that have built a whole business on teaching other nurses how to become a cannabis nurse. What? Right? Which basically is saying that in 3 to 5 years after I have started Nurse Academy up and running and successful, now I can coach other prospective business owners, right? So you're always thinking about leveling up. I'm always thinking about leveling up, right? Cannabis industry is huge. You do not need a degree or a certification as of right now to enter the cannabis industry. You could decide today, I am a cannabis nurse. You can start your Instagram just like that. So I definitely love those nurses that work in cannabis. I think cannabis nursing and pediatrics is still very much acute care inpatient right now. Meaning, I've absolutely given THC products to kids, especially ones with seizures that won't stop, or autistic children. not really autistic children, put it through people chill right on out. I haven't seen it as much in the outpatient setting for peds, but for adults, yes. Yes, how can you start that? Can you? So that's a great question. So it just depends on what exactly you want to do. Like if you want to work directly with patients, if you want to kind of start your own business and become a cannabis kind of coach. I know this one person has built like a whole career around that. They have a cannabis podcast, a blog. They do talks and workshops and um, conferences and stuff, right? So we'll talk about that as we get to the end, like what's kind of the best way to get started. All right, flu clinics, moving on down. Can't remember what number we're on, but we're moving on down. Think about it as it relates to hospice. Yes, and as a end of life practitioner, absolutely. That is great. And some cannabis nurses work directly with pain management groups. So that's another way you can get in. Flu clinics are easy, great for my new grads. So I want to kind of give, everybody a little piece of the pie. You can do this once you license, you haven't even started working yet. So I do this for my new grads, especially out here in Southern California, because it is so competitive, you guys, to get a job out here. Southern California, Northern California, and greater New York area so far are the main places I see. And so sometimes I'll tell them, if you see some flu clinic positions, go do that. Easy money, flexible schedule, real low stress, okay? Cons is sometimes they can pay a little bit less because it has a lower skill set. You really can have LPNs or LVNs doing it too. All right, infusion nurses. This is a great, and after this, I'm gonna talk to you, I'm gonna give you 3 concrete examples of how you can turn your side hustle into your business, into an entrepreneur role. And infusion nursing is one example I'm going to use. So for now, thinking about infusion nursing, there are companies, right? Infusion nursing companies that hire per diem. I know when I did it, I went out to, it was like infusion home health, pediatrics. So I would go to the kids' homes, access their portacafs, start their IV antibiotics, change their PICC line dressings, give them IV antibiotics. Some of them, I was starting actual peripheral lines on them and meeting with them. So that was cool. It was easy, good pay, had a lot of autonomy. Y'all know I like that. I want to like clock it in, give me my assignment. Okay, I'll be back when I'm done. Okay. The cons are though, you got to be pretty independent. You get out there and get a hard stick and the whole family's looking at you like, right? And you can definitely make medical errors. You got to be careful. And there was a lot of documentation. If you're looking for infusion nursing side hustle, that's what you search for, infusion nursing. Now, this is a great way to work from home. These are probably where you're going to see the majority of remote nursing jobs are in case management, chart management, auditor, utilization review. This is not only just a great side hustle, this is a great career to think about. If you are ready to step away from the bedside, you can get a certification as a certified case manager. I can't remember the name of the certification. If somebody knows it, they can put it in the chat. But you can become certified, work from home, following up with patients, making sure that they are utilizing healthcare services in the most cost-efficient manner. Is basically what you're doing. You are saving people money. Okay, like this patient went home after a post-op ACL. How can we maximize and make sure that they're using the services more efficiently, right? It can be a little isolating and tedious, and I put those cons just because personally I know I couldn't do it. That would just be too much for me. But this is good. Always in demand. Always companies hiring for that. Ooh, y'all. So actually one of my clients put me on game with this one. Now for this one, you need to be a nurse practitioner, but this is something I want y'all to just think about and put on your mind in case you are already a nurse practitioner or are thinking about it. So Suboxone is used in addiction management, right? And there is a free certification you can get through the Substance Abuse and Mental Health, I think it's SAMHSA Services Administration, to become a certified Suboxone provider. You got to be either MP, a PA, a doctor, okay? You got to be a provider role. From there, guys, you can make so much money, and there's so many opportunities to work with different pain management companies. Look, we're in the midst of an opioid crisis. Suboxone is the new methadone, like it was 20 years ago, you know, in the 80s and 90s during the crack era and the heroin era, right? So this is now becoming the move as people are getting off of these opioids, these Percocets, these Oxydone, etc., and transitioning using Suboxone. I don't know a lot about it. I work P's. It's not a big issue in our field. But this is a great opportunity. And the first person to tell me about this was a client from Black on the Job. And she was working for a pain management company, and they were paying her $75 an hour. And she was a nurse practitioner. She felt like that's not enough money. She was in New York. She was like, that's not enough. What's up? That's only 75. She got certified on her own, left that company, and went back to consult for them and charged them $175 an hour. So from there, she cut her work week in half, okay, because she needs to work less than half the hours, and went back to school for her DNP because she felt like the population was really challenging and manipulative, you know, working with drug addicts, and she didn't really like doing it, but it was good income for her to be able to focus on getting her doctorate and not have to worry about making money. So keep that on your radar. I think we have 2 or 3 more side hustles. Health and wellness coach. Now this is something you can do, right? And you can finesse this into an entrepreneurship role as well, right? And this is why it's good to think about things that you already know, that you're already good at, that you already have a passion for, right? So I had a client the other day, and she's like this fitness person. You know, I'm not there, okay? But she's fit, and she's eating the gluten-free, GMO-free, meat-free, dairy-free diet, right? And she's all about the wellness and the juices and all of that, right? And I was telling her that when you're a nurse, pretty much any business or side hustle you do, having that RN behind your name legitimizes you, right? So people are going to trust if you're an RN and now you just pop up with the Instagram and now you got your own health and wellness and fitness company, right? It's not going to come to you overnight, but you keep posting workout tips and diet tips and this and that. Eventually, she can create her own e-guide selling diets. She could have a Zoom exercise sessions. She could be coached, right? So she could become this health and wellness coach. She could start to do talks. She could write for blogs. She could do conferences and workshops on this, right? She can contract herself out to different high schools and come and do a healthy and wellness workshop for them for $500 or whatever, right? So this is great. Must be an NP if you're doing it in the licensing capacity, like you are working with a congestive heart failure on reducing their diet, like a low sodium diet. So you work for a company and you're the health coach and you follow up on their diets and health and wellness. In that case, usually you need to be licensed. All right, I think we got two more. Yeah, 3 more. Freelance writing. If you're interested in freelance writing, Portia, do you know her last name, Dr. Dunkley? I think it's Portia Warford, I think is her last name. She's a Black nurse. And I think her Instagram is The Right Nurse. I'd have to think about it. Send me a message afterwards. And she is like the go-to person for nurses who want to freelance write. And I'm in a Facebook group with her. It's something I want to do, but I don't have the time. So I just dream about it and I just stay in a group so I can be nosy. Plus, I like to know as much as I can about all different fields I can so that when people come to me for coaching, I know exactly where to send them, right? And so what she does is she writes for everybody. I've seen her writing articles for universities. You know, universities will have a blog and they're like, why should you get an MP in informatics? She just wrote a whole article on that for different, like Minority Nurse Magazine. She works also for a Resilient Nurse. They did an article with me. There it is, The Right Nurse. Follow her on Instagram. So that's a great other side hustle. Selling merchandise, great side hustle / business. You could be selling scrubs. You could be selling your League of Extraordinary Black Nurse t-shirt. I don't know if y'all know we have merch. Okay, so go to the LEBN.com and get your merch. You could be selling mugs. You could be selling stickers. You could be selling cute little shirts that say new-ish nurse, right? It's a very competitive market, may require some overhead, but it's really good if you're a creative person and wants that autonomy. All right. And then lastly is what I'm doing, which is nurse to nurse coaching and consulting. And obviously you need to be at an established point in your career to be able to reach down and coach others, right? And it is a competitive market. It's a lot of us that are out here that do career coaching, and it's a market that's built on trust and reputation. So if you guys, I know a lot of you guys are my BOTJ people, have been following me for BOTJ for the last 2 years, can remember when I first started at BOTJ, I did a whole bunch of free workshops for BOTJ. I would do side hustles for nurses, 6 ways to get to 6 figures. I mean, I did free workshop after free workshop. When I started Starter Nurse Academy, I did 2 free workshops for California Nursing Association. They had 200 people in those workshops. Boom, that was like my instant trust, right? And now to keep my business going, I do a free workshop so that those that don't know me, I had 100 people in my last free workshop. They all came in. It was on tips for getting into a residency program. And that was so that to build that trust so that they would know what they're paying for the workshops next week, so that they trust I know it, right? All right. Woo. We almost done, y'all. Got about 5 minutes. So whatever side hustle you're thinking about doing, chances are you can finesse that into a business. And I want us to really, really consider entrepreneurship in some way, even if it's just a side business that you have, because you see with COVID-19 that our jobs can sometimes get disposable and there are hiring freezes, right? Like I know a lot of new grads right now that are stuck that have hiring freezes, but I had one client who's stuck in a hiring freeze, so she can't get hired, but she had already started selling nurse t-shirts when she was in nursing school. So that income is keeping her going, right? Let's look at some examples. If you work as an infusion nurse, you could start your own IV hydration business. IV hydration. So you guys know now where you get your little vitamin IV hydration, your hangover mix, your vitamin C. They got these like centers where you can go to get them. But now what I've been seeing is a lot of mobile hydration businesses where my friend actually did this the other day when she was a little hungover. So they came to her house. I don't know how much she paid, and they gave her the fluids at her house. They started the IV. It was a nurse that came, etc. So you can finesse your side hustle and get the experience that you need, right? And the income that you need, and like make sure you like it, and slowly finesse that into your IV hydration business, right? And what's great about branching slowly is that it's not income dependent. So if I'm still working my main job and got a little infusion nurse hustle on the side, right? Then I'm thinking, all right, let me start my hydration business. I got a brand. I started the Instagram. I got cards. I got websites, but I don't have a client. It's okay. If that client don't come for another month or two, it's okay. You still got your full-time job. You still got your other stuff, right? So you're going to slowly, but if you can get one client, you can get 2. And if you can get 2, you can get 20, you can get 100. So you're going to build that clientele slowly while still having your full-time and or side hustles, right? But if you love infusion, if this is something you're passionate about, this is all going to be a labor of love. All right, let's say you work in outpatient surgery. You got a side hustle, working, doing Saturdays, recovery at an outpatient surgical center. You can finesse that into a concierge recovery business. So concierge recovery businesses are basically, let's say if I went and got liposuction, it's an outpatient surgery, so they're going to send me right home. And I'm in LA, so Beverly Hills, Westwood, we have all these people that go for plastic surgery, and a concierge recovery nurse basically will meet that client at the hospital at the surgery, get all the post-op instructions and stuff for them, bring them home, do the nursing side of the recovery, the vitals, checking the wound, making sure they're paying, but also a little bit of the other stuff on the side, like you might have to make some soup too, right? Because this is a concierge recovery business. And people do this when they don't have someone who can recover them. So I live alone, for example. I live completely alone. If I had lipo surgery, I would have to have a friend or somebody come, or I could pay you in your concierge business. And to be honest, I'd probably rather do that because now I'm paying you, so I know you're going to be here, right? And you could pretty much meet me at the hospital, drive me home, go get my payments, make sure I eat, check my wound, and check my vitals. And they make good money, okay? Well, they charge good money. All right, and then let's say you've done teaching. You can finesse that into curriculum developing and consulting, as I talked about before. All right, so lastly, what are the keys to success for starting your own business if you're thinking about going that route? So we talked about academic, we've talked about side hustle in terms of finessing those into our business. You got to get your networking going. So you need to be immersed in your career, in your field, in social media. Your whole LinkedIn needs to be entrepreneur nurses. You need to be in Facebook groups such as Black Nurse Entrepreneurs. That's a group that I'm in, right? If you're thinking about going to DNP, you need to be in the DNP groups. I'm in a DNP to be or not to be Facebook group. I'm in DNP of Colors group, okay? Y'all, I'm in like 30 nursing groups because I'll be in there finding clients. Plus, I like to see what they're posting about and see so I can guide them and stuff like that. We already talked about that LinkedIn, and we talked about small steps, right, to bigger steps before you branch off. I still have a completely full-time teaching job. So if I don't get a single coaching client this month, it's not going to kill me, okay? And the more coaching clients I get, though, and the more Starter Nurse Academy takes off, now I can think about maybe one day I'm gonna leave my teaching job, right? Maybe I need another year or 2 or 3, right? But right now, it's not a stress and it's not a pressure to me. It's something I love to do and I'm passionate about. And I do have a lot of clients. They're coming. I don't have a problem getting them. But if I didn't, because I'm branching off slowly, I don't believe in just quitting your job and just flapping out there. It's working. Okay. And then the last 2 keys to success are get as much free game as possible. And I'm telling you this as somebody who is paid game. Like, you got to pay for my coaching sessions, right? I'm not giving away just free game, but get as much free game as possible. Like this. This is free game, right? Free webinars, free workshops, YouTubes, following people on Instagram that do what you want to do and just soaking in all that information, right? So the first thing you want to do, let's say you want to be that cannabis nurse, you're going to do all the research and everything you can on cannabis nurses, follow them, looking at people's website, what do they do, how much do they charge? So then you want to invest in career and business coaching, right? So then you might want to find a cannabis career coach. Or if you're not sure which direction and side hustle or business you want to go to, take a step back and get a career coach. So that's what I do. I'm a good person to come to if you're still kind of trying to figure out, and then we're going to figure out which way, and I'm going to give you your beginning steps. But if you truly want all of the game to be a cannabis nurse, you should probably get a cannabis business coach, right? So I try to stay in my lane. But if you're not sure where you're going, like, do I want to go back to school? Do I want to side hustle? I have all these ideas. I need help narrowing it down. That's my specialty. Once we narrow it, then I'll be like, okay, boom, follow this person, sign up for this class, look for this business coach, be off, go on your way and be successful, right? But the most important key to success, the absolute most important key is your mindset, okay? Is your mindset. And I'm gonna pretty much take the slides down for that last part. And I kind of talked about it yesterday on my Instagram page. So if you're not following me on Instagram, it is Doc Miller Nurse Coach. Make sure you're following me. And I talked about how important it is to get over that fear of failure, because that fear of failure will keep you paralyzed. It will keep you scared to branch out, scared to go back to school, scared to apply for that charge nurse position, scared to start that side hustle, scared to launch that business because you have this fear of failure. And you have to really do the internal work so that the failure doesn't define you, right? Because I'm not the kind of coach that's going to tell you that you just might fail. My business just might fail. And I was talking about on my IG live or my IG story yesterday about how I had the idea to start this business in 2017, had sat down, thought about it, I'm gonna do this, and I was too scared. It took me another 2 years before I would start my businesses because I was too scared to fail. And it's not like I got to a point where I was confident that I wouldn't fail. That's not the key. That's not my philosophy. Is that I got to a point where even if I did fail, even if I do, I'm going to be okay. I'm going to dust myself off. I'm going to start another business. I'm going to figure out another niche. I'm going to get another side hustle. I'm going to be okay. My business failing or succeeding is not a reflection of my inner worth as a person. And so when you put so much pressure on yourself, it's like, what if I fail, Dr. Miller? Okay, what if you do? Right? So you got to think of these things, launching your business, applying for that job, going back to school, like a date. It's a date. You might apply for the school and get rejected. Oh, I hate to say it. I've applied for stuff and I've applied for scholarships and got rejected. I've applied for stuff and got rejected. Okay. But you might apply and you might actually get it, right? But it's the same as like you go on a date. You don't know how the date goes. The date might work out, might not. They might not like you. But if you are basing your whole self-worth on whether or not this person sitting on the other side of you at the date likes you, that's a dangerous place to be in, right? And that will be a place that will keep you paralyzed to where like, you're not going to go on any more dates because what if they don't like you? And so you got to do the inner work in order to do any of these things to make sure that the failure does not define you. And what I've also recently learned is that the success can't define you either, right? Where you are in the inside has to be fixed. I said yesterday, fixed and dilated. It has to be in there and it's open and it's all dependent on me, right? The other thing is you got to kind of get out of your own way. You can't just keep talking about like, I want to do it and I want to do it and I want to do it. Well, you got to do it. You have to take that first step, right? And sometimes it's just getting into that mindset and deciding that I am an entrepreneur. I'm going to be a grad student. I'm going to be a charge nurse. I'm going to be a nurse informaticist. I hate that word, y'all. So making sure that your mindset is in the right place, that you're not defined by failure, that you are ready to take that leap and take a chance out there is also a big part of doing this, okay? So let's see if we have any other questions or comments. The resources are available. Take advantage. Thank you, Dr. Duckley. I don't know what I want to do, but I do know that Bedside isn't exactly where I want to be. That's right, Shirley. That's okay. It is so many opportunities away from the Bedside, Shirley, that you want to go where you feel fulfilled. And you're going to hear those nurses that are like, oh my God, you leaving the Bedside. That's not real nursing. Blah. You just push them to the side. Okay. I can't tell you how complicated it is, y'all. When I'm out somewhere, okay, I'll be cringing. Here come the question. Oh, what do you do? I'm like, dang. All right, here we go. I'm a nurse. Oh, what kind of unit? What hospital? I don't work in the hospital. What? What do you do? I teach. You teach, like, you know what I mean? So everybody thinks that nursing is just bedside, but we are so much more than that. We are so much more, Shirley. So good for you. Bert Quinn said, fear of failure will make you feel stuck. I also follow Michelle Rose online. She was the first nurse entrepreneur that I saw and met and connected with when I got on Instagram. And she says, fear will keep you broke. Ooh, I said, oh, that spoke to my soul, right? Fear will keep you broke. Now, we're nurses. We ain't never broke in that degree, but imagine the potential that we could be making, right? Imagine how big my career could be if by me launching my own business, starting to do consulting, starting to do coaching, right? Branching off. So fear will keep you stuck. Fear will keep you paralyzed. And y'all, fear will keep you broke. Where we going to keep on making this 70, 80,000 for the rest of our lives, right? Or we can get out there and get this money, okay? Lucretia said, this is so good. Thank you. I'm glad you enjoyed it. And remember, you guys can always book a follow-up coaching session with me if you need one-on-one. This was great. I love this. Thank you for making me feel comfortable. Want it all. Yes, want it all and get it all. Because as I told them in my workshop, this other workshop I was doing, I got a secret career. I don't tell a lot of people yet, right? But when I'm about 45, I'm 38 right now, I'm going into a whole nother career, right? By then, in my mind, I'm gonna have my businesses going. I won't be teaching anymore, okay? And it's at that point, and this is deep desire in my soul, y'all. I want to become a music engineer. I want to go to music engineer school because I'm such a dweeb. I want to learn the right way. I want to be the person, y'all know, y'all see the rappers and they in the studio, and then you see that person messing with them knobs, and they says they mixing and mastering. I want to mix and master. I want to mix and master, Shady. I want to do it all. So there is no limit to what we can do, right? And I'm going to use all my nursing skills, all my analysis, all of those skills for that new career, right? Dr. Dunkley said, I love Michelle. Yes, make sure you follow her, Michelle Rhodes online. Gonna write that down. I'm in occupational health and school nursing. Everybody say how stupid that is. Shirley, you tell them that Doc Miller said they stupid. Boom. Jennifer said, woohoo, this was wonderful. I have an idea to start a consulting business for so long. So Kim, that's something I can definitely help you for. And Ashadi said, music does wonders for healing. Yes. And I don't know if it's going to be healing music, Ashadi. It's going to be more like rap. I don't know how healing that is, but you know, that's going to be my other career. So thank you all. Thank you all so much. Any final questions? Go ahead, Dr. Dunkley.
No, this was great. I'm just chuckling at you. If you need some background vocals, holler at me when you start that, okay?
Right? I'm like, why can't I be a music engineer? Like, you know what I mean? She said, we in
I'll
peace.
do the singing and you do the mixing, okay? I'm cool
right.
with that.
So thank you for having me. Thank you for having me, everybody. Make sure you follow me, Doc Miller Nurse Coach. And if you're a new grad, follow Starter Nurse Academy. Go ahead, Dr. Dunkley.
Thank you so much. This was awesome. It's always a pleasure working with you. I always learn a little something too when I listen to you speak. So, you could tell by the comments, people really appreciated this. So thank you for sharing your knowledge and your expertise with us. You guys, please stay tuned. Follow us if you're not already following us on Instagram at the LEBN, and I'll actually put that in the chat since I've been putting everybody else's in the chat. This is the IG. Thank you, Dr. Miller. There's actually an underscore between the and LEBN, just so nobody gets lost. But please follow us. There will be more educational opportunities to come. We do have the option for you to become a subscriber or a paid member, where you get a little bit of extra benefits with that. We are still a growing organization, so please be patient with us. But we're definitely working to provide you guys with more opportunities for advancing us as Black nurses who need support and development. So thank you again for all your time. And for tuning in. The recording of this will be available soon on the website. As soon as I'm able to upload it, I will do that so that you can rewind and get fed all over again, okay? Thank you all for attending, and have a great evening and a great rest of the week. Good night.